Good day, everyone. My name is James Young, and today I have the pleasure of presenting my poster presentation, which will give insight, an overview, and summary of a proposed program that I'm seeking funding for, which will address the high blood pressure, hypertension issue in the Detroit metropolitan area. So, to begin, this grant proposal aims to secure funding for a comprehensive blood pressure wellness program strategically implemented through the Wayne Health Mobile Unit to combat the disproportionate rates of high blood pressure and/or hypertension prevalent in the Detroit metropolitan area. By deploying targeted interventions, community outreach, and accessible healthcare services, this initiative seeks to promote cardiovascular health, reduce disparities, and empower individuals to take proactive steps towards managing and preventing hypertension. The Wayne Health Mobile Unit was established in 2020 under Wayne State University and located in the heart of Detroit, Michigan. The Wayne Health Mobile Unit is dedicated to providing convenient and accessible blood pressure screenings to underserved communities. With the support of the Wayne State University Board of Governors, a team of 50 staff and 5 volunteers delivers a range of essential services, including COVID 19 screenings, routine blood work, and health referrals. Our partnerships with Wayne Health, Detroit Community Care Network, and the State of Michigan Department of Health and Human Services are instrumental in our mission to play a vital role in preventative care, aiding residents in maintaining and/or improving their overall well-being. In terms of needs assessment, high blood pressure or hypertension, particularly prevalent and highly prevalent among African Americans in the United States. According to the American Heart Association, African Americans in the United States experience higher rates of hypertension and or high blood pressure than any other racial or ethnic group. In Detroit, Michigan, this health disparity is further pronounced with a significant portion of the African American population facing challenges in accessing effective blood pressure management programs. The Wayne Health Mobile Unit recognizes this need and strives to bridge the gap in providing accessible and impactful healthcare interventions. In terms of the budget, to effectively address unmanaged or uncontrolled high blood pressure and hypertension, we've devised the operational budget for the Detroit Blood Pressure Wellness Counseling Program, totaling $179,000. This comprehensive budget covers personnel costs, community outreach and partnerships, mobile unit operations, training and development, technology and data management, venue costs for partnerships, a contingency fund for unforeseen expenses, and funds for evaluation and impact assessment. Every dollar is strategically allocated to ensure the success and sustainability of our program, making a real difference in the lives of our community members. In terms of the work plan and timeline, from January to February 2024 is what I theme program development. During January and February 2024, the focus is on developing a comprehensive program plan. This involves identifying the target population, establishing program goals and objectives, and creating an implementation and evaluation strategy. Concurrently, efforts are directed towards securing funding through grant proposals, sponsorships, and other financial avenues. Assembling a dedicated team is another crucial step, involving the recruitment and hiring staff, volunteers, and community partners. Additionally, educational materials such as brochures and flyers are crafted to inform the community about blood pressure and the importance of overall wellness. This groundwork also includes identifying and securing community sites where the program will be offered. The next step, from March to April 2024, is what I theme the program launch preparation phase. Moving into March and April 2024, the emphasis shifts towards marketing and promoting the program. This encompasses the distribution of educational materials, presentations, and leveraging social media to reach the intended audience. Simultaneously, the recruitment and enrollment process begins establishing a structured approach for identifying and enrolling participants. A training program is developed and implemented for staff and volunteers, covering aspects like blood pressure measurement, counseling techniques, and data collection procedures. Essential supplies, including blood pressure monitors, medical equipment, and educational materials, are ordered in preparation for the program launch, which goes into May to June 2024, which is in fact the program launch and early operations. In May into June 2024, the program is officially launched, commencing the provision of blood pressure screenings, counseling, and additional support services to participants. The focus now extends to data collection and progress monitoring, encompassing blood pressure readings, participant satisfaction, and other relevant outcomes. A crucial aspect of this phase involves making real-time adjustments to the program based on collected data, identifying areas for improvement, and implementing changes accordingly. Next, we move to July to December 2024, which I theme the ongoing program operations. So from July to December 2024, the program continues to provide services and monitor progress. Blood pressure screenings, counseling, and support services persist, accompanied by ongoing data collection to gauge the program's effectiveness and participant outcomes. Simultaneously, preparations are underway to ensure the program's continuation beyond the initial one-year grant period. This involves strategic planning for sustainability and long-term impact. Next, from July to December 2024, there's a continuation of the program evaluation and continuation planning. As the year progresses, the focus remains on delivering services and monitoring progress. Simultaneously, efforts are directed towards planning for the program's continuation. This entails developing a comprehensive plan to sustain the initiative beyond the grant period. Additionally, preparations are made for the final phase, which involves preparing an evaluation report, summarizing the program's activities, outcomes, and overall impact. This report will serve as a comprehensive documentation of the program's journey and overall effectiveness. Now, moving on to evaluation. How do we measure our impact? Through a rigorous evaluation plan utilizing a mixed methods approach, quantitative data gathered from pre and post program blood pressure screenings and participant surveys will measure changes in blood pressure levels and gauge program effectiveness. Next, qualitative insights from focus groups, discussions, and key informant interviews will illuminate the cultural relevance and the participant experiences. Next, regular check-ins and continuous monitoring will enable real-time adjustments, ensuring the program remains responsive to community needs. This evaluation extends beyond the short-term outcomes, aiming to assess the program's long-term impact on community health. Our findings will be shared through reports, presentations, and community forums, contributing to a broader understanding of effective interventions for cardiovascular health in diverse communities. What do we aim to achieve in terms of outcomes? First, a significant reduction in the prevalence of uncontrolled hypertension or high blood pressure within the target population. Second, increased knowledge and awareness of blood pressure management strategies. Lastly, improved overall cardiovascular health outcomes among our program participants. These outcomes align with our commitment to making a lasting and positive impact on health and the well-being of the citizens in the population, and more specifically, the vulnerable and underserved populations of the Detroit metropolitan area. Next, I would like to take a moment to provide some acknowledgments. So, of course, before I conclude, I must express my heartfelt gratitude. Thank you to the American Heart Association, a few of the national leadership, supported me greatly in my journey through Purdue University's Masters of Public Health program by being my recommenders for the program. I have done about 7 or 8 years of local and national volunteerism with the AHA, and that was used as a gauge when applying for the Purdue University Masters of Public Health program to vouch for my public health experience. So I'm definitely grateful for their support in that realm. Also, special thanks to Dr. Philip Levy for allowing me to perform my practicum through the Wayne Health Mobile Unit. A deep appreciation for Bethany Foster, my practicum advisor, my preceptor, who has guided me through the practicum experience and competency projects. Lastly, immense thanks to the Wayne Health Mobile Unit staff, and that would include the nurse practitioners, the community health workers, the research assistants, et cetera, et cetera. I'd like to really thank them for their unwavering support of my hands-on practicum efforts, and this collaboration has been crucial in shaping and developing me to become that much more of an effective future public health practitioner. And with that, that concludes my presentation, my poster presentation. I hope you enjoyed watching and listening to the information, and thank you for your time.